In this video, we will discuss about major CAR-T side effects or this adaptive T cells side effects. When we are discussing about one of the clinical results of the CAR-T, that is B CAR-7 T cells, we have discussed about this cytokine release syndrome data. So how this CAR-T is related to the cytokine release syndrome, that we have not understood in that video, because our main focus in that video is to understand the data. Here we will understand how this CAR-T is related to the cytokine release syndrome. And there is one more uh, types of side effects that are reported in the patients who are treated with this adoptive T cell or the CAR-T immunotherapies. However, its mechanism is not yet been understood correctly because of the lack of the animal models that can in which these studies can be performed. That is this neurotoxicity. So here the what here a brief overview it is shown here what could have been going on to cause this neurotoxicity, that is blood and this is brain. So and after some times there is a altered blood brain barrier because of that is shown here, and because of that this altered blood brain barrier will cause the more transfer of these bloods into the bloods that contains the CAR-T cells into the brain, and this will cause some increase this will cause some side effects or undesired reactions, and that might cause this kind of disease or this kind of problems has been reported, that is delirium, aphasia, seizures, cerebral edema, intracranial hemorrhage. However, it is not clear whether this is because of the CAR-T cells or due to some internal problems or other problems that is already exist within the patient. However, one thing that is clearly been understood and have a consensus among the research community is the relationship between CAR-T and the CRS or cytokine release syndrome. So how they are related is shown in the bottom side of the figure, where uh, they are considered an example where CAR-T cells are designed against this leukemia. So when they interact with the leukemia, it will this CAR-T cells will get activated and it will release the cytokines to kill the leukemia. That is IFN gamma, so for example IFN gamma, and one of the biomarkers for this CRS is IL-6, and it will also be released. And once these leukemias are been killed, then its debris will be detected by the other immune cells which are already present within the patient or in the host, that is for example this macrophages, and these macrophages will detect the debris of this uh, lysed leukemia, and it will further enhance it will also release the cytokines to target the remaining tumors. And because of this cascade effect or the synergetic effect, there might be a possibility, and the effect of the CAR-T to release cytokines is depends on the amount of the tumors the patient has, amount of degree of the tumors the patient has. So this cascade effect of release of the cytokines by the CAR-Ts and also by the immune system of the host sometimes might cross the threshold limit of the cytokines that a patient can handle, and in some cases that could be even detrimental and can have a lethal consequences. And some of the disease that people have reported because of the cytokine release syndrome is this tachycardia, hypertension, capillary leak syndrome, and the organ dysfunctions has also been reported, such as AST and ALT elevations, hyperbilirubia mania, respiratory failures. So in order to reduce this cytokine release syndrome, the one thing that is generally been employed when a patient undergoes any immunotherapies is to suppress the immune system of the host. So in this case, the cytokines that are released by macrophages will be reduced because it will be suppressed before the patient is being treated with these CAR-T therapies. So this is one of the reasons why the patient undergoes therapies to reduce the immune system of the patient. such as the chemotherapies or the other kind of therapies, to so that they will have a minimum cytokine release syndrome effect, and it will remain within the threshold levels of the patient. So these are some of these major CAR-T side effects that are been reported in the clinical trials or in the patient who are undergone different kind of CAR-T immunotherapies. If you need to understand more about this CAR-T side effects, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.